Hello, and welcome to Neutralize Your Nightmares, how to create harmony through structured conflict management. My name is Kim Harms, and I'm a dentist, and I've been around the block in dentistry in a number of areas. I worked for the Federal Service, United States Public Health Service. I actually worked as a federal employee in my undergraduate days. I worked for the state of Minnesota. I developed a pilot project for developmentally disabled patients here in Minnesota. I also was an associate for a while and a clinical assistant professor at Loyola University in Chicago. I've also kind of been around the world. I work with dental offices in Mongolia and in Rwanda. I've been to Armenia. I've been to lots of places in the world that had to manage conflict. So it's really an area that I have a lot of interest in. You know, conflict is universal in this world today. We cannot even turn on our televisions or go outside without having a lot of things going on that we have no control over. But conflict management in your dental office is not one of those things. You can manage it. You can keep it under control. You can work with your team to create a harmonious unit devoted to taking care of your patients. And that builds productivity and just creates happiness for everybody. So the ultimate goal of this webinar is that every one of you and all of your patients and every member of the team walks up to your office in the morning with a big, genuine smile on their face and anticipates a wonderful day. So let's get started.
Don't we all just feel sometimes like we just are so frustrated at the end of the day, not because of our clinical care, but because of conflict that occurs around us or conflicts with patients or our staff? Conflict in the office affects everyone, and conflict with one person tends to disseminate throughout the office and onto our patients. So, what do we do about it? Well, one of the first things we need to do is just for a second step back and put ourselves in the other person's shoes. Let's start with our patients. What do our patients see when they come into our office? Well, we bring them up into our office and we show them into the waiting room. Oh, no, 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 it's not a waiting room, it's a reception area. They're in the reception area being received. And then we have someone come and call their name and bring them back into the dental operatory. Oh, no, 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 it's not a dental operatory, it's a treatment room, right? And in the treatment room, we put them in a very comfortable chair and we put on a nice little napkin. But that napkin has got some plastic backing. That's a pretty strong napkin we're putting on them. And we're kind of we're clipping it to them. It's not good enough just to stay there. We have to kind of clip it to them, kind of anticipation of what's going to happen, right? We put the patient back in the chair, make them as comfortable as possible. And then what do? We shine a big light right into their eyes, right? Now, this picture is absolutely genuine because it's a picture of my dentist. I took this picture. So, what happens when you're laying down there and all of a sudden a big bright light comes into your face? Well, first of all, one shadowy figure comes out of the right side, another shadowy figure comes out of the left side. And what do they look like? They look like Martians, don't they? I mean, they've got a big googly eyes kind of coming down looking at us. Their faces are covered. You know, they're looking at us and opening our mouths. We have to open our mouth, and then suddenly they bring out these sharp instruments. They bring out things like probes and explorers. And then they bring out a needle and they poke us a little bit, right? They poke us, and suddenly our mouth feels a little funny. And after that, what comes next is even worse. They bring out a drill and they start drilling in our mouths, and we can look back there, and as we look up, we see human tissue, the dust of our teeth flying out of our mouths and landing very conveniently on that nice little napkin that they put out there because, you know, we could anticipate all this was going to happen, right?
When you really think about it, it's absolutely amazing that our patients show up to their dental appointments at all. We prod, we scrape, we probe, we explore, tooth dust is flying, drilling is going on. It's amazing. It's amazing that they walk in the door really sometimes. But why do they do it? They do it because their dental health is important and they know that that's what's required to be able to keep their teeth for a lifetime, which we can do nowadays. Isn't it wonderful the strides we've made over 100 years? My grandmother had her teeth in a jar next to the bed. It doesn't have to happen if we can get that dental health continued from birth to death. So we've made great strides. and they're happy about that. But when they come into our offices, they agree to all that other stuff. They agree to all that stuff because they expect us to be focused and committed to doing the best we can and taking care of them without distractions. And conflict is a big distraction, and people can sense it. If you're in that dental office and one of the team members is not happy with you and can express it by maybe instruments being handed a little too quickly, or by a tone of voice, or by something that the patient might hear in the background as people are walking around working with other patients. They didn't sign up for that, and they don't want that. And that's going to distract from their appointment. In fact, conflict can turn that consensual extraterrestrial experience with the googly eyes and the Martian-looking people back there into a nightmare. But by minimizing conflict in your office and turning all of your energy and the energy of your staff away from the conflict and onto the patient, you can turn that otherwise otherworldly experience into a very pleasant one. And that's one of our goals.
The way to do that is develop a very specific conflict management program within your office. Specific and written, two important things. So what is a conflict management program? Conflict management program is a safe, structured, effective system that's necessary to maintain a harmonious working environment and manage patient complaints. Basically, it allows the patients and the staff to know what their expectations are, and we also know how to manage complaints when they come up. Complaints are going to happen no matter what. We need to be prepared for them. Conflict management program, a specific structure program, also promotes resolution of issues instead of revolution. And what I mean by revolution is if you're a team member, you may choose to leave the team. You may choose to go somewhere else. That's one way you can have a revolution in an office. Another way is to complain about everyone and then bring the office morale down, which is horrible. Of course, patients can choose to leave the office. They can choose to report your office to the Board of Dentistry or peer review, or leave a horrible review on the internet. So patients have a lot of options. Of course, we don't want any of those things to happen, so let's go for the resolution promotion instead. Conflicts is very, very complex. There are lots and lots of underlying causes. Typically, the conflict we're dealing with right at the time in the office is due to a lot of other things that happened before. Sometimes not, but most of the time it is. There's lots of underlying causes. One of them is a perceived hierarchy. In dental offices, we tend to have hierarchies that are artificial hierarchies because really we're a team. If you're a professional basketball team, there are some people on that basketball team that are paid millions and millions of dollars, and there are others that are not paid quite so much. They're paid a lot less. But when they get out on that basketball court and they begin to play, every team member plays the same and is expected to put 100% towards the goal of winning the game. And winning the game in dentistry is taking absolutely wonderful care of patients and having happy patients walk out the door. So let's get rid of that hierarchy in the office and have everyone remember that we need to focus on that patient and providing that patient with a wonderful experience at the dental office. We can all have controversies or misunderstandings. We come from different backgrounds. There are a lot of generational differences, baby boomers versus millennials. There are differences due to culture. And there are just, we think differently. In our country, a lot of political differences occur, and people think differently about the same thing. Those things can be an underlying cause of conflict and even how they can perceive a particular issue. Certain people have control issues, and what that means is they want to have control of the situation, and many times trying to exert control issues does not work out so well, especially when it's a system or a procedure that you don't have much control over. That doesn't work out very well. And then we're going to talk about passive aggressive behavior and manipulative behavior in a little bit more detail. Passive aggressive behavior is an indirect resistance to the demands of others and avoidance of direct confrontation. You think, this is my husband, by the way, in this picture, And this is how he thinks everybody at the office, think of him. And they pretty much do because I'm the wife and I happen to be in our office. My husband and I practiced together for about 30 years in a private office, and I tended to be the conflict manager here. So my husband loved to just be adored by his wonderful staff, right? But sometimes that adoration wasn't present. Sometimes the staff really, were not real happy with my husband. And of course, it was really hard for him to understand that. And most of the time, he didn't even know. I was a little bit more attuned to when people were happy or unhappy. My husband's not really attuned to that. He doesn't pick that up very well. And that's great for me. I have to say, being married to him was wonderful because he doesn't pick up my flaws very easily. But sometimes, when in a passive aggressive situation, the person, it seems as if they are trying to help you. It seems as if they're going along with what you want to do. But in the background, they are not cooperating. And they are sometimes undermining what you want to have done without letting you know. And passive aggressive behavior can have absolutely devastating effects on the team morale and on productivity. If one person is allowed to be passive aggressive in an office, the rest of the staff can pick that up, and you have a whole office full of passive aggressive behavior, which is a miserable place to be. Another type of behavior that's very destructive is manipulative behavior, and this includes bullying and gossiping. This occurs everywhere, and I'm not trying to pinpoint anybody individually. We are human beings and we are all prone to this. But we have to really watch out, especially if the manipulative behavior part gets to be really a problem. Bullying is an issue. People do not like to feel that they are being bullied in an office, and it happens all the time. And these behaviors can range from very innocuous to very brazen, and they can combine with passive aggressive behavior and cause even more problems. So really in your office, watch out for the worst, I think, in an office, which is passive aggressive behavior and what I call the Jezebel factor. And this is to me a disaster of biblical proportions. This is when there's someone in the office that basically tries to control everything and can lead to some major disasters. Embezzlement is one that comes to mind very quickly, and also many other issues, including loss of patients and loss of staff members. So, who was Jezebel? Well, 2,500 years ago, Jezebel was a queen, and she was so evil and mean that her name is synonymous with almost everything evil, particularly manipulation and seduction. She used every trick in the book to cause issues and problems and take care of herself. One of her neighbors' name was Naboth, and he had some land that he liked. It was beautiful, but Jezebel wanted that land. And she asked Naboth. Naboth said, "No, I'm not going to give you my land." So Jezebel spread false rumors to his neighbors, and those false rumors, the gossip, the bullying behavior, the isolation, caused Naboth's neighbors to stone him to death. So she got her way. They stoned him to death. She took the land. She is the ultimate mean girl. And take a look. She did not directly stone him to death herself. She had other people do her work. Classic example of a manipulator. So the good news is Jezebel did not turn out well at the very end. It didn't work well for Jezebel in the end because eventually she lost power. Her servants threw her out a window. She splatted on the ground into a million pieces. The dogs celebrated with a feast, and she was the main course. So there really wasn't very much left to bury Jezebel. But really, that was no worry, no problem, because there really wasn't anyone to mourn Jezebel. So it just worked out just fine in the end. And we see Jezebels or Jezebels or Jezeburnies all the time, unfortunately, in our lives. And they can cause a lot of trouble. They can cause much trouble in our lives. And so we have to really watch out for that, especially in the dental office. So passive aggressive, the one thing to remember is that passive aggressive behavior can be managed. And with good leadership, passive aggressive behavior can be overcome. The Jezebels, Jezeburnies, it can be male or female, not so much. And I think I think Bernie Madoff is probably one of my best examples of a Jezeburny who thought only of himself and left so many people in the lurch, lied and manipulated, covered up. And so you can see these examples all throughout history. And the best thing to do if you have a Jezebel in your life or a Jezeburny is keep as much distance as possible. If they're in your family, it's a little bit harder to manage. You just kind of have to put some barriers, put some boundaries up. If they're in your office, and you try to, you really try to help them overcome the issues and difficulties, but you find that they're not going to do it, it is better to let them go as quickly as possible. Again, I think the Jezebels and Jezebirnies are responsible for a lot of embezzling that goes on and a lot of destruction of staff morale. Fortunately, they're a very small minority. Really, it's a passive aggressive and other types of behavior that can be modified and changed, that you see in your office most of the time. So, not too many of them, but get rid of them if you can. So, what's the elephant in the room when it comes to conflict in the dental office? Let's just take a look at this. The elephant is that dentists are frequently in denial. They don't want to see it. If there's a Jezebel in their office, they don't want to see it. If there's someone being passive aggressive, they don't want to see it. Most dentists would like to just go into their office, do the dentistry, go home, and have somebody else manage everything else. And that can cause a lot of problems because a team needs a leader. And if the leader is not paying attention, the team falls apart. So dentists in denial are really one of the biggest elephants in the room when it comes to conflict management. Dentists also are very uncomfortable leading, especially when feelings are involved. Uh, Most dentists are not real excited about trying to help people that have disagreements with each other, or whose feelings are hurt. It's a big issue, but it's so important because feelings really carry the day for so many issues that happen in an office. Feelings, and people are feeling that they're not being respected, or their feelings are hurt. That can affect the rest of their day and then ultimately patient care. So we really need to find a way to address these issues, and we'll talk about that a little bit later, how to do that. Dentists, it needs to be remembered, are ultimately responsible for team behavior. So even though they don't want to deal with it, even though they don't like what's going on, they are the ones who are ultimately responsible. So they have to deal with it at some point. In developing a program, or perhaps designating the responsibility through conflict managers is a really great way to do that. The next step when it comes to conflict management and preventing conflict in your office is to build trust. The most important step is to build trust.
So, how do we take all these factors and address conflict head on? First and most importantly, we have to build trust. No matter who you are in your office, to your patients or to your team members, everyone has to know that you are focused on what's the most important to them, what's the most important to your team, what's best for the patient. You have to be focused on that and not what's best for yourself. It's a really important thing to learn. It's like the golden rule, right? But that's really critical and important. Human beings are really great at figuring out who's for them and who's against them. In fact, in 1974, I had an experience that proved that to me and had long-term consequences in my life. You may have noticed I talk with my hands. One of my hands is not like the other. My mother took thalidomide when she was pregnant with me, and we think that's why I'm missing fingers. We're not sure. I really can't remember what happened, but I didn't have fingers when I was born. But despite that, when I was in undergraduate at the University of Maryland, my first week, I met this really cute guy. His name was Jim. And over time, we were dating, and I figured this was 1974, so please forgive me. I'm a victim of my time. 1974, women were not liberated yet. We were kind of on our way. We really weren't there yet. So he wanted to go to dental school. I happened to be a zoology major. It was kind of a good fit. So I thought, if I went to dental school, maybe he would marry me. Maybe he would. It was a good plan, right? So when I went to my advisor after my first semester, my advisor happened to be Dr. Nasty. That was his nickname. I won't give you his real name, but his nickname was Dr. Nasty. I should have been a little concerned by that, but I was a freshman. I was low man on the totem pole, so I got Dr. Nasty. So anyway, I went in to see Dr. Nasty, and Dr. Nasty walked in the door. He sat back in his chair, and he had a very large cigar that he was smoking. Big cigar that he was smoking. This was the 70s. And so I went into his office and I said, okay, I really want to go to dental school. That's where I want to go. But, I'm a little worried because, this hand thing, do you think they'll let me into dental school, right? My question. It was a good question. And Dr. Nasty just looked at me with his cigar in a very condescending way, by the way. And he said to me, well, there's no way they would ever take you in dental school. You don't have any fingers. We don't have 7-finger dentists. What are you thinking? And I thought, he's got a point. Okay, he's got a point. Okay, I'll have to find another way to get Jim to marry me. He has a point. And in that minute, I had given up my dental career. He was an expert. He knew what he was talking about, right? So I got up to leave, and when I got up to leave, I was walking out the door, and as I closed the door, just as I was closing, he said to me, "But maybe if you were a man, they would let you in." Do you believe that? What the heck? That guy had absolutely no concern about me. He was thinking about himself and his own ego. And I think the interesting thing is, rather than convincing me to give up my career, I gave up my advisor and I switched. I switched to another advisor, which was a big thing for me. I was not very aggressive in those days. But I went down to the advisor hall, and there were a lot of little old ladies that were probably younger than me now that were sitting behind the desk, and they were kind of angry at the University of Maryland. And they really were kind of angry. And I said, I want to change advisors, and they weren't really happy that I would do that. So they gave me another advisor. Now this advisor had a different name, and it wasn't a very nice name, but I'm not even going to say it because it doesn't fit her. Her name was Dr. Potter, and she was actually quite scary. She was a geneticist, and I took her class, and she was one that stood in front of the class of 500, and she had this scraggly hair. She kind of looked like Marge Simpson's sisters, if you ever watch The Simpsons, scraggly hair. And she had these little glasses that stuck around on her eyes, and she looked over us at her glasses with her scraggly hair, and she always had a cigarette, always a cigarette. Again, this was the 70s. She would lecture with the cigarette dangling on her lip like Velcro, as if I don't know how it stayed there, as if she Velcroed it off. She somehow could manage to work it with I don't know how she did it. So I had Dr. Potter, and I was terrified. And I really thought, this isn't going to be any better. But I was so angry at Dr. Nasty that I went there. I had the courage then to go and see Dr. Potter. And I knocked on her door, and she answered in a very pleasant voice, not at all as it was in the lecture hall. And so I went in to see Dr. Potter, and Dr. Potter said, "Well, sit down." And I sat down, and I said, I want to go to dental school, but I only have 7 fingers. What do you think? You think they'll let me in? What do you think? And Dr. Potter said something very, very important and a lesson for me for the rest of my life. She said, I don't know. I've never been asked that before. Let me find out. Let me find out. Not only did she research this, but she called the University of Maryland Dental School at that moment and asked me to go see Dr. Bushness. Dr. Bushness was the head of restorative at that time. And she made the appointment for me. She didn't tell me to go make one. She made the appointment for me. So sure enough, I traveled to the University of Maryland Dental School, and I said, "Hey, what do you think? Can I go to school with 7 fingers?" And they said, let's see, can you hold a mirror? And I said, "Yeah, I can hold a mirror." He goes, "You're fine." Because in dental school, one hand goes to dental school, the other hand holds a mirror. Who knew? I didn't know. Dr. Potter didn't know. Dr. Anastos didn't know, but he didn't even care. He did not even care because he wasn't even gonna take the time to find out, right? So I got to go to dental school. Dr. Potter changed my life simply because she said, I don't know. So when patients come in to your office, you have to figure out, who are you? Are you Dr. Nasty that looks at them and answers questions and does things that fit with your ego? Or are you Dr. Potter? Are you willing to go that extra mile to take care of them and do what's best for them? Are you willing to go that extra mile to help become partners with them in their oral care? And if you are, you're going a long way to build trust with your patients.
So I recommend the first thing that you do if you want to build trust is to read my favorite book on trust building called The Trust Edge: How Leaders Gain Faster Results, Deeper Relationships, and a Stronger Bottom Line by David Horsager. It is a fabulous book, and the reason it's a fabulous book is that it divides trust into 8 pillars. This is the dentist's dream. It's in line. There are pillars. There are things we can get our heads around. All of these 8 pillars must be present to promote trust, but losing only one will destroy trust. So these pillars are very, very, very important. The first pillar is clarity. We need to be clear and ambiguous. We need to have treatment plans that are clear. We need to let the patients understand how much the treatment's going to cost and an estimate. We can't always predict exactly, but give them an estimate so they know. And we also need to make sure that they know about how much time it's going to take. We need to give them all the information we can so that they understand as much as they can about the dental appointment. And of course, things don't always go according to plan, but being clear is very, very important to developing trust. One of the things I do in Minnesota is I am kind of the intake person for the peer review program. So when patients call to complain about their dentist and reporting to peer review, I'm the first person that talks to them. And I will tell you that most of the cases of peer review were not clear about what to expect and what the possibilities would be, some of the possible complications of the treatment that they received. We need to explain the risks, the benefits, and the alternatives of treatment to all of our patients. This part of being clear is critically important. We need to be compassionate. Patients need to know we care about them and we care about our team members. Extremely important and a very important component of trust. We need to have character. Our patients need to see that we do what's right over what's easy. If we have a crown with an open margin, we take it off and give them another one. I mean, we don't see things that are poorly done. We do the right thing. That's important also for our staff members and our team members to see that. We need to be competent. We need to be safe and fresh. We need to make sure that all of our equipment is up to date. We need to have a good look when patients come into the office so they can see that we're keeping up. We need to go to continuing education to make sure we keep up to date on everything that we're doing. We need to have commitment. We need to stand through adversity. If you have a team member, for instance, or a patient going through hard times, you need to maybe adjust things a little bit to compensate for some of the difficulties they're going through. And if you have something adverse happening in your life, you also need to serve as an example in that area too. You need to be committed to stand through adversity. You need to have connections. Now, this is also critically important because it involves listening. Listening is a skill. When we're treating our patients, typically we're the only ones talking because we have our hands in their mouths. They can't talk back. So sometimes it's hard for us to learn this one, but we have to, before we start putting our hands in their mouths, give them a chance to listen. Give us a chance to listen. Give them a chance to tell us what's going wrong. Give us a chance to tell us what their expectations are, what their fears are. Connections is extremely important. We need to deliver results. That's the contribution part. Delivering results. Things need to work, and if they don't work, we need to stand behind them. And consistently, this is also critically important in dentistry because we could have a wonderful, wonderful clinical experience in the back, deliver the best care possible, and if they go up to the front desk and the person at the front desk is in a bad mood and makes them angry for one reason or the other, has a control issue, embarrasses them in front of all the people out there, we can lose them. They could turn that wonderful experience into a poor one. Conflicts with patients frequently have the same causes as conflict with the team. You must have all of the trust pillars in place, working with patients as well, just as we described. Patients are much less likely to file a complaint, a bad review, or a lawsuit if one of their complaints is handled appropriately. If they have a problem, it's important we have a system in place to take care of that problem in a consistent manner, so at least the patient knows something is happening. All team members, this is so critical, should be trained to handle patient conflict. You may have one or two team members that carry the brunt of a conflict and carry it through the end. It's good to have one person the patient can call if they ask questions about what's happening, but all of the team members need to be trained in how to manage a patient if a conflict arises. When you have a conflict or complaint, again, very important to be proactive and not reactive. If you have all of those trust pillars in place, you're going to be much more ready for a complaint. The patient's going to be much less likely to be angry with you. If you're not proactive, many times you can be reactive. You're not ready for it to come, you can be reactive. It's important for all members of the staff to understand that complaints are just part of the territory, and they need to learn how to handle complaints just as they need to know how to put in a sealant, or just as we need to know how to do a prophy, we need to know how to handle complaints. We need to address conflicts and complaints very, very quickly. The longer that conflict is allowed to stay out there, the more upset the patient gets, and the more likely things are to fester, and more things can build up in their head. So address them quickly. Empower your frontline employees. Make sure the people, especially at the front desk, are empowered to manage a complaint if it comes to them. What steps should they take? What should they do next? We need to own the problem. The problem is the patient's unhappy. It doesn't mean you have to, what the patient says is always right. Many times it isn't. Many times it's a misunderstanding or a different point of view. But we have to own the problem, and the problem is we have an unhappy patient, and we have to manage that. We have to own the solution. What are we going to do to fix this? What can we do to fix this? That's part of the problem too. The patient needs to know you're going to own the solution. One solution might be the patient gets dismissed from the office if it really gets bad. If the patient is aggressive or a bullying patient, the solution may be the patient gets dismissed from the office. So that's one solution. But most of the time, we need to really take a look at how we can make our patients happy so that they'll come back to us and refer their family and friends to us. We also need to continuously improve the process of conflict management. When we have one result that turns out badly, we need to learn from it. We're all going to have failures. We're all going to make mistakes. We need to learn from them and continuously improve the process. And document. I can't say this enough. Write down every word. If the patient is abusive, write down that they were abusive. Try to record as much data as you can when there's a conflict, because that conflicts are much more likely to show up in a board review or in a lawsuit. You need to document as much as possible whenever there's a conflict. When a clinical or a clerical error occurs, there are several steps that you need to take. First one is acknowledge the complaint. Don't try to pass it on to someone else or blame the patient. Acknowledge that there's a complaint. We hear you. We are sorry that you are unhappy. Acknowledge the complaint. Apologize sincerely that you're very sorry that this is happening to the patient. We're going to get resolution as quickly as possible. Create resolution as quickly as possible, and have a system in place to do that. If it happens at the front desk, what does a front desk person do? Where does that person go to get resolution for the complaint? If there are small complaints, it's best to give the people that first hear about them the authority to take care of them. One thing that we had in our office was little movie tickets we kept in a drawer, and if somebody had to wait, for instance, more than 10 minutes, we would go out there and give them a movie ticket. We wouldn't wait for them to complain about it. But if there are some small things that the people at the front desk can do to make the patient happy, give them their authority to do that. Always follow up. Make sure the patient is happy. We may think we've solved the problem, and we haven't. So always follow up after a complaint is addressed, especially if an error occurs. You really want to follow up if that happens, and make sure the patient is doing well and is happy.
All of us are going to experience clinical or clerical errors in our practices. None of us are perfect. It's just going to happen. It's just part of life. We're going to mess up. But how you manage those errors and how you have developed a trusting relationship with people before the error occurs has a great effect on the outcome of those errors. I practice in a small town in Minnesota. And one day we had someone come in who was a little bit smelly. He had a lot of farmland around Farmington, and he'd been out in the barn, so he was a little smelly. He was pretty dirty. He probably hadn't been to the dentist for 10 years, and he had a lot of problems. And it was an emergency that we took care of. It was a root canal that we took care of. And frankly, I have to say that when he first came in, you may have guessed that maybe he just wanted all of his teeth taken out. You kind of figured that might have been the case. But we gave him his options. We took our x-rays, gave him his options in our exam. And sure enough, he wanted to restore his teeth. He wanted to get back to good oral health. It turns out he had been afraid to go to the dentist before. And because we treated him so well, he was going to stay with us and he was going to take care of his teeth. That was a win-win for everybody. We felt so good. As it turned out, he became a very, very popular patient in our office. He'd come in, we would all be laughing. We had a wonderful time. I also had a great relationship with my dental assistant. Again, a trusting relationship, and if she did messed up, I would explain it to her with love, and we had just a great relationship. And if I messed up, believe me, I heard it too, in a very trusting environment, and we had a good relationship. And those two relationship investments proved invaluable on the day I really messed things up. It was a warm spring day. I was working on my patient. I was doing a root canal number 14. I had the rubber dam in place, had the rubber dam. We use video glasses. We love to show patients movies and movie glasses. Oh my gosh, I'd say, hey, when the movie's done, your root canal will be done. So it really helped build trust and helped get them settled down. So he was sitting back there watching his favorite movie with the rubber dam on, and I was doing a root canal in 14. When suddenly I was flushing it out with a little bleach solution, and somehow the tip of the syringe came off, and I emptied the entire syringe full of bleach into his eye. I don't know how I did it. I went under the glasses, I went between the rubber dam and the glasses, just in the right place, and into his eye went a syringe full of bleach. Oh my goodness. My assistant and I jumped into action. We jumped up. We found out why that eye flushing thing had to be there. We took him over to the eye flushing thing. We flushed out his eye as quickly as we could. And my dental assistant took this patient to a local doctor to have everything checked out. Now, while they were gone, I thought my career is over. I have now blinded a man. I mean, I just, all these things go through your mind. I had no idea what was going on. I thought, I blinded this guy. My career is over. This is terrible. This is terrible. This is terrible. So I wasn't really focused on the next patient. I have to admit that was one of those times I had to get a little more focused on what the next patient needed. Fortunately, I had a little extra time for that root canal, so I didn't really have one for a little bit. And sure enough, about an hour and a half later, one of my receptionists came up to me in my operatory, and I was with another patient. She goes, "You have to come up. You have to come up right now." And so I excused myself from the patient. Luckily, when they're watching those movies on the video glasses, they don't care if you leave. It's really a nice tip. So I went up to the front desk, and sure enough, my patient was coming in with my dental assistant. He was leaning on the dental assistant. He looked horrible. And his eye was covered with gauze. They had patched his eye, and under his eye, and I hadn't seen this before he left, but under his eye was a trail of blood dripping down. My heart sank. I thought, oh my goodness, I have blinded somebody. I could never practice again. I'm never going to be able to hold a drill in my hand again. I'm never going to be able to hold a syringe in my hand again. What have I done? I've destroyed this patient. I blinded this patient. And he took one look at me, and he could see in my face that I was completely devastated when I saw him. And all of a sudden, he started to laugh. He started to laugh, and my dental assistant started to laugh. And everybody in the operatory, everybody in the reception area, and all the people behind the reception desk, all were laughing. And I didn't know what was so funny because, I had just blinded a person. The next thing you know, he pulled off this patch, and it turned out this was all a big joke. It turned out that the physician, who I knew and I had a trusting relationship with, thought it would be really funny to have him come back looking like I had just blinded him, when in fact everything worked out. There was no damage done. His eye was a little irritated, but other than that, he was going to be fine. And the reason I tell this story is, oh my goodness, what if I had a dental assistant that I didn't trust? What if that dental assistant that took him over to the doctor said, "Oh, you better just sue her. She puts bleach in people's eye all the time. Let's go. Might as well just sue her." What if that had happened? Because that does happen in some offices. There are some office personnel that will do things like that to you. What if that had happened? Or what if I hadn't built a trusting relationship with him? What if I had decided that he was not really valuable enough to treat well, and I had not treated him, and he didn't trust me to do well? What do you think would have happened? That story would have gotten all over town, and probably the damage done to his eye might be thought of to be more, because dentists are not supposed to empty a syringe of bleach in people's eye, and everybody knows that. But because I had trusting relationship and I cared about those people, and then they cared about me, and it kind of came back. And I think that's what really needs to happen in an office. You need to develop those relationships. They will serve you over time, and they will immeasurably improve your life, improve the satisfaction in your life, and they may just well prevent you from facing an attorney or some other people. You can solve those problems together without getting third parties or the internet involved in any conflict you may have.
So let's move on to how we develop that system, that successful conflict management system. One important footnote: make sure to include every part of your system in your office policy manual. Absolutely critical, because it needs to be written down and everybody needs to understand what it is and how it works. First of all, you need to designate an effective and neutral conflict manager, not like this guy. But you need to have someone in your office that's considered neutral and compassionate. Two very, very important considerations for your conflict manager. What if you don't have a member of the team that would really qualify? What if there's no one in the team? If you think about it, that's kind of sad. If there's nobody in the team that can be universally thought of as being compassionate and neutral. Sometimes that does happen. But most of the time you can find one, and typically we recommend that there be a little silent vote, but not competition or anything for this. But designate someone who is really thought highly of by every part of the staff. They can't be part of any cliques. But sometimes there are no team members that qualify. So what do? Well, the dentist can serve as a conflict manager, and although that might seem like it defeats the purpose because you want to get away from this, the reality is when you have a structured program, then you take care of it as it comes, and those lingering effects don't carry with you. So the dentist can serve as a conflict manager, and that works well. Or you can pick an outside mediator or an outside consultant. Maybe if you have a consultant that does a management consultant in your office, that person can do it, or even a third party, a spouse or somebody else. They just have to be considered neutral. And what I'm recommending here is really a formal mediation process similar to the process. I'm a civil mediator, so similar to a civil mediation process. And so it's time tested, it's worked its way, through generations. So this is the process that mediators use, and I'm recommending this. However, everybody has a different style. And if you've got someone that can do the same thing, which basically is bring the two parties together and have them come up with a solution themselves, use what works. But this is a civil mediation process. The first part of the mediation process, the first step, is to orient the two parties, kind of frame this. We're here together to try to solve the problem that's occurring, and we're going to work together, and our ultimate goal is to have both of you two happy at the end, that we've reached some sort of a solution. The second step is to share information. Get both sides together and let each person tell their story in front of the other person, because you want the other person to hear what the other one thinks. Sometimes there might be an underlying cause that they don't want to tell the other person. If that's the case, then you may need to take them out into a separate area or have the other person leave so you have a private area and discuss with them what some of the underlying causes are, what some of the real issues are that they may not want to share with the other person. However, if you do this with one person, you have to also take the other person out and do it with the other person so that each person gets time to talk to you privately. You have to, again, be neutral and give both parties equal time. Then identifying and framing, basically, you just repeat the concerns. Like I hear that this issue is happening or this issue is happening. Reframe it, say it in different words. Bring in, if you can, kind of those hidden agenda issues, maybe respect, or maybe someone's not being asked to go to lunch with everybody else. Some kind of work those concerns in. Try to find the common ground, though. Take what each person can agree to, start with that common ground, and then try to build outward. Then identify the options. So here's option number one. Maybe we can do this to solve the problem. Option number two, maybe we can do that. And as you're doing it, you're generating options with the information from the two parties. You're not making your own options. You don't want to go rogue as a mediator. As a mediator, you really need to be right in there in the weeds with the two people that are working on this problem. So try to come up with some options that'll settle the problem, brainstorm, model some options. And then hopefully they'll all agree and they'll say, yes, this would be a great idea. We'll both agree to do, I'll agree to do one thing, I'll agree to do the other. This is our solution. And you have a closing. And you say, okay, we have decided what we're going to do. And at the closing, you need to make sure you do a few things that will help you in the long run to seal the deal. The first one is make sure you take notes and write the agreement down in a very neutral way and have the parties sign them. Make sure they agree to what you've written down, have them read it, and make sure that they sign them. Also, discuss the options if things don't work out. So, what happens if in a month from now things aren't working out? You get back together in the mediation session and you figure it out again, and you just keep on doing that. Eventually, people tend to get the idea that they are responsible for solving this themselves, and things usually get much better. Also, express gratitude for participation. Say, I'm so glad you came here. We worked this out. It's just so much better to work it out between ourselves and derive our solutions between the two of you. We're really happy you did this. Thank you very much for doing that. And then celebrate. This is so great. High fives, whatever you need to do to celebrate. Celebrate so that they realize that they have accomplished something. This is an important part of being in that office and working effectively in the office, and that is to make sure that conflict is resolved. Also, just like everything else, we have to be accountable. We have to make sure that all of that hard work that you did at the mediation phase doesn't fall apart, and that they don't start, people have a tendency to go back to their old habits, and we just need to kind of keep on doing what we can to change those old habits into new habits that it's conflict free. So we really need to have some accountability there. So follow up on the resolutions personally each month until it becomes a habit. It just takes a word or two. Hey, how's everything going? Is it working okay? And then they know you're following up. They also remember they need to keep on doing what they're supposed to be doing. Make sure the parties are cooperating to ensure the conflict is resolved. So as you talk to both of them, make sure both people are cooperating. Each person has to do their part. They have to make sure that they feel the other person is doing their part as well. And this is one thing too. It's really important to reserve an agenda item at every team meeting, and I hope you're having team meetings at least once a month, just to verify that the resolutions that infect the entire team are being held in place. We don't want to go at the team meeting and talk about resolutions between two parties or three parties at all. You don't even want to talk about those things at a staff meeting. You want to talk about those issues only between the parties involved. But many times, some of the conflicts involve the entire team. For instance, something having to do with time off or continuing education, or when you get your uniforms, or any of those types of things. Are things that need to be addressed in the team meeting on a regular basis. Make sure no one is surprised by bringing this topic up, but discuss it, keep it out in the open, and that makes sure. One of the worst things that happens in an office is that there's something. It's, for instance, I remember one office, the hygienist felt that their instruments were not being replaced on a regular basis, and it would build up and build up and build up, and resentment and anger would build up over time. And if we had just been able to address this in a team meeting once a month, it would have been taken care of a long time ago, very, very likely, because nobody would bring it up, and they would just kind of, the rage would be seething in the background because they felt that their hands were starting to hurt, and maybe perhaps because the instruments were not being replaced on time, that sort of thing. So don't let those conflicts build up in the background. Talk about them every single month. And one of the things that needs to be said is if something isn't being brought up right now, it's not a conflict. So you can't go back and complain to your other team members after the staff meeting that something hasn't been worked out if it's not brought up at the staff meeting. None of that behind the scenes stuff that typically does not go well. So what if the two parties will not agree? Now, unfortunately, yes, this does happen. So we really have to address the situation that occurs if we have parties that just will not agree to help each other out, or not agree sufficiently to keep the other party happy. So what do we do now? Well, the first part in mediation is a mediation. In a mediation situation, the two parties come together and resolve the issue themselves, basically with the mediator is just a helper. They come to the decision themselves, and typically they're much happier when they do that. But if they're not going to do that, you just can't let the problem sit there, so you have to get an arbitrator to come in. So typically, the dentist or the owner, or the office manager, is the arbitrator, and then they just make a decision. They take all the information they hear from both sides, make sure you're safe, make sure you're neutral as much as you can, take the information from both sides, and then you just have to make a decision. Now, one of the problems with arbitration is that the losing member uh, they may accept and adjust, and that's a good ending. Or sometimes they bring that conflict underground and they just wait for something else to come up and it rages its head again later on. So you just have to be careful. The losing party in an arbitration is not as happy because in mediation there really are no losing parties. So there's a losing party in arbitration. Of course, the other option would be to leave the practice, whether they're a patient or a team member. Also, the patient also may accept and adjust to the arbitration, choose a new dentist, take it to peer review, take it to the board of dentistry, take it to a lawyer, or take it to the internet. So uh, neither of these really works out very well, but the reality is you need to solve the conflict one way or the other. And arbitration and solving the conflict is much, much, much better than just letting that conflict sit and grow and be and the pot to be stirred in the sterilization area time and time again. So it's much better to arbitrate and just take these risks than it is to keep it there. Of course, mediation is the preferred method. So, why would you want a formal conflict management program in your office? First of all, having this formal conflict management program reduces conflict, and this is important because it makes everyone responsible for solving the conflict. People are more likely to go the extra mile to help prevent a conflict from taking place in the first place if they know that if the conflict occurs, they have to go back and resolve it. It cuts down on conflict dramatically just by having conflict managers in place. It is just amazing how much it does that. Also, remember, negotiated decisions encourage cooperation much more than arbitrary decisions do. So try to encourage the mediation part of the conflict management, but arbitration decisions must be made and certainly are much more likely to prevent issues than letting the conflict just sit there. A conflict management system reduces passive aggressive behavior and resentment because when people are angry or upset, many times they become resentful and they pass that resentment from one person to another. So you get that conflict management program in place and you can decrease that behavior and you decrease that resentment. Overall, a formal conflict management program increases the productivity of your practice because you can now focus on your patients. You can now focus on getting things done. All that time and effort and energy is now devoted to the things that need to get done in the office rather than on the conflict itself. It's amazing how that works. It also increases patient loyalty and overall office harmony and team happiness. So it's just a very important program to have as part of your overall office management system. So sometimes I think when you're introducing a new program, you need to use a little humor. You need to use a little humor because I know that when you go into an office and you bring in, we're gonna start this program. This is great, yay! Most people say, well, we've been managing well enough all these years without one of these. Why do we need to do it? There's always a little bit of uh, kind of staff members that are not really excited about change that are going to resist it a little bit. So there's always a little resistance to change. So what we've developed here at thedentalmediator.com are the 10 commandments for working together cooperatively. Moses got brought down 10 commandments from Mount Sinai thousands of years ago, and it really did work out pretty well to keep the people under control, keep the people happy, have people working together. So we developed some of our own, and we really want to make sure that we are completely respectful of Moses and and God's commandments, but we're just doing some a little bit fun for our dental offices. So the first of the 10 commandments, and remember this is something that you can call the dental mediator or just go to the dentalmediator.com, and we can have one of these that are ready to print out if you'd like, and so you can post it in an area where members of the team tend to congregate and to remind them of just some of the important things that are necessary for working together cooperatively. The first one is honor thy employer, thy employees, and thy co-workers. That just makes sense, right? Just treat everyone with respect. Sometimes there are complaints just because things happen during the day that are frustrating. So the number 2 addresses that problem. Do not complain when the days get busy and the autoclave breaks down, for such occurrences are part of the job and complaining causes great suffering among your brethren, right? That's very true. Number 3 involves just keeping yourself in perspective in the reason that you're there in perspective, and that is to take care of and respect and treat the patients that come in, the team members that are there. And that is love your patients, do good for those who cannot seem to keep their mouths open, and pray for the complainers who constantly persecute you, right? We got those people in our offices. Number 4 involves the concept of being envious of other people. Maybe they work in a job that their position might be something that you would like to have, or maybe they are, you feel that they are more highly valued by the doctors or the team members, and those thoughts just cause problems. So you need to really take care of envy. So number 4 is do not have envy or bitter strife for your coworkers, especially the one who leaves dirty instruments for others to clean. Am I right? There's always one. There's always one. For where there is strife, there is confusion in every evil work. So just watch how you feel about other people. Number 5. This is pretty self-explanatory. Do not take the name of your dentist employer in vain, for it is he or she who signed your paycheck. So true, right? Number 6. If you have a complaint, do not let the sun go down on your wrath. Seeketh instead righteous resolution and office policy as soon as possible. Number 7. Understand and accept the rules of the omnipotent OSHA. Do not wear your mask under your nose or forget to put your safety glasses on, for if you do, the OSHA regulators will swoop down upon your office as a plague, and there will be sorrow and gnashing of teeth when your dentist must pay large sums of money to cover your shame. Number 8. You are not your brother's keeper. Do not be concerned about the performance of your teammate brothers and sisters unless they directly relate to patient care or interfere with your own performance. Instead, focus on your own work and do it well so that you can be called blessed among your co-workers. Number 9, do not go to lunch. We all know lunch can cause lots of problems when we get together and start talking at lunch, right? We all know about that. So do not go to lunch and dwell upon devilish thoughts. Instead, be charitable in your opinions of others and come back from lunch full of happiness and cheer, so that the rest of the team will rejoiceth in your company. And finally, number 9, we all know that, again, bringing on a new program does not exactly make everybody happy in the beginning. Sometimes they don't understand why you're doing it. So, number 10, do not complain to your office workers that following office policy of conflict management and taking responsibility for bringing up concerns when they happen will do no good, or that nothing ever changes. Such statements destroys your organization's ability to create harmony in the workplace and are loathsome and vile in their effects on the dental team. Am I right? I'm right. So, life is too short. Neutralize those nightmares by positively managing office conflict, something that you can manage. Just do it, and do it now.
I hope you enjoyed this webinar and that you can now see the potential for significantly reducing conflict in your life and building relationships that promote harmony in your office between your team members and with your patients. This also works at home, so I hope that helps too. For more information, please go to our website, thedentalmediator.com, or you can ask me questions individually if you have them at drkim@pinelakelawfirm.com. If you would like some more personal help or more personal information or more detailed information on how to develop the conflict management program specifically within your office and personally within your office, we would love for you to participate in our coaching programs. We have some special offers that will come right after this webinar that I hope you stay tuned for to hear. But no matter what you do, whether you go out there and build your conflict management program yourself, or if you get some help from us or from anyone else, I hope that you can understand the value of a harmonious life in the reduction of conflict, in the building of trust, and the building of relationships. Thank you very much.